Hi, everyone. My name is Teresa Brockie. I am an Aaniiih tribal member from Fort Belknap, Montana, currently an associate professor at Johns Hopkins School of Nursing, and have a joint appointment with the Johns Hopkins Bloomberg School of Public Health. I am currently the president of the National Alaska Native American Indian Nurses Association.
Before we get into the state of nursing, I want to ask a little bit about you. You're a nurse leader. What experience or moment has shaped your leadership or influenced you to want to be a leader like you are today?
I think what has inspired me first to become a nurse was the nurses that worked in my community, particularly the public health nurses that worked in my community, and I was always impressed upon their ability to go within the community and provide care for individuals, families, and the community as a whole. So I was first inspired by them, but prior to that, I was inspired by the stories of my grandmother when she provided care for our people, and so I think she was a nurse before nursing was a profession. So she provided care for those who were infected by tuberculosis. She provided support she was a midwife. So in learning those stories early on, I was inspired by their work. And as a leader, I never saw myself really being inspired to be a leader. I think the needs of our community has kind of pushed me in that direction, or lack of representation in all aspects of nursing. Has really pushed me to that direction. So I have, I think, a voice and a story to tell, and so I'll continue to do that. And if that's leadership, then I guess that's leadership.
So it sounds more of a calling to you. You have been surrounded, it seems like you were naturally surrounded by caregivers. You became a caregiver and you want to continue to care. And so you mentioned earlier about stories being told to you. And I think it's important that here within NANAINA, as all of the ethnic minority nurses associations are getting together, rallying together for underserved communities, it was interesting to hear it be said that NANAINA is underserved. Mm-hmm. And so what are your thoughts on how we as underserved nurses, we're also experiencing that in our nursing profession, how do we then kind of pull our bootstraps up so that we can still have the energy to come back and service our communities?
I think that, like, some of us don't have bootstraps to be pulling up. What inspires me is a vision for a future where the healthcare of our people are met. Whether I'm part of any of the nursing organizations that comprise the National Coalition of Ethnic Minority Nurses, whatever group I come from, I think that our vision is to meet the needs of our people.
According to the National Council of State Boards of Nursing, hundreds and thousands of nurses are leaving the profession, or they're considering leaving the profession, citing workforce issues, shortages, stress, burnout, workplace conditions, and those are some things that we've talked about and are trying to address for the profession. But what is it that you think is not being talked about enough when it comes to why nurses are leaving?
So even though we have a huge nursing shortage in Native communities, particularly in rural remote settings, if we look at the nurses who are employed by Indian Health Service, tribal or urban organizations, 60% of those nurses are Indigenous. So we're meeting the needs of our own community. And so that means, to me, like, if we want to address the nursing shortage and vacancy rates in these communities, we need to recruit nurses from those communities.
You mentioned recruiting from your community to further on become nurses. Now, with the changes that we're experiencing, or that seem to be on the horizon, with nursing being not considered a profession, how will that impact the ability to influence more minority nurses to go on to become nurses?
I don't, in particular, with regards to Native American communities, I don't think that that will have a negative impact on Indigenous or Native American nurses, primarily because it's a higher calling. It's a calling to address the needs in the community, and nursing is a good way to do that, to give back to the community, to try to address the healthcare needs of individuals and families and communities. So as long as there's a higher calling, a higher need, it won't impact. I think what needs to happen is we need to be better as nursing schools to recruit from these communities, these rural and remote communities.
You know, there's a lot of discussion about a shortage of nurses in certain areas, like rural areas. There are certain shortages in certain specialties, like maternal health. If we're concerned about a nursing shortage, if people are leaving, we need to keep the pipeline going. But how do we do that where we're not recognizing and supporting our nurse educators in a way that keeps them wanting to be educators? It seems like it's a very big role, but yet they're not as recognized or compensated as perhaps they should, given their role.
I think we need to prioritize, and for whatever reason, there are not enough nurses seeking like a doctoral program in nursing. There are not enough nurses going into seek a PhD in nursing, which is our faculty, which is those who provide education for our nurses. So I think that's one factor where we don't prioritize it enough. For whatever reason, they're not. I think 1% of nurses have a PhD in nursing, which is a huge limiting factor for trying to address the shortage of nurses in the United States. We have to have our strategy to address that shortage should include the fact that we need more PhD prepared nurses. The education of our nurses, what we found is, again, I'm going back to rural and remote settings, there's a mental health treatment gap in these communities. And so a bunch of that work, or a lot of that work is being addressed by nurses. So in one of the communities that we worked with, and they had experienced a suicide cluster, public health nurses in the community said that 95 to 98% of their visits are mental health or mental health or behavioral health related, yet they lacked the training that would support the needs of the community. So I think, to me, that means we need to better prepare our nurses to meet the needs of our communities in the area of mental health and behavioral health. And so one of the ways that we've moved to try to address that was to adapt a mental health certificate program for nurses that work in Native American communities, nurses and other providers. So we just finished a pilot of that project, and hopefully soon we'll be able to implement that nationwide.
Wonderful. That sounds like an excellent and needed program. And then one last question that I have for you here is, this year's Nurses Week theme is the power of nurses. When you think of the word power, what kind of power do you want nurses to recognize in themselves right now?
I think the most powerful way that we can recognize our own power is to understand and acknowledge our voting power. We are a large group of people that need to use our voice and our voting power to elect people who advocate for us, advocate for the work that we want to do, and who are not going to pass legislation that removes our criteria as a profession.